if the tibia sticks out.
We're going to go into this.
Here, keep video. I want this.
All right.
You want
It's a
this?
video camera.
So, before we
Are you kidding me?
before we do that, let's look at the evaluation of the PCL first. Okay. So we're going to evaluate the PCL, and in this position, we're going to put our thumbs, especially this joint, right on the tibial condyle. Okay. So I'm like this. So for me to touch your femoral condyle, I have to flex my thumb. That means your tibial condyles are anterior to the femoral condyles. I have to flex that much to get to your femoral condyle. That tells me right away, without even looking from the side, that you have a normal anterior step off, and your tibia is not posteriorly subluxed. Make sense? Just basic anatomy. That's all it is. And that's a lot of this stuff. Sometimes these books, they have 58 million tests. We end up using only a couple of theories, and we base it on science and anatomy. And this is it. It's taken me almost 3 decades. I repeat, almost 3 decades. But I'm finally figuring this out. Okay. So, again, I'm going to put my tibia, I'm going to put this joint on the tibial condyles. I have to flex to hit your femoral condyles. That tells me you have a normal step off. And if we were looking at you from the side, it would be no posterior sag. So if we were going to do a posterior draw, we would relax you, sit on you a little bit, make sure the hamstrings are relaxed. Now that we got the step off, then we're just going straight posterior. Okay? You try that. Then we'll do the active quadriceps test again.
And he said that there may have been a sprain.
He said just the IP joint.
IP joint on the tibial condyle, and you're going to have to flex to, what is this, the pulp of your thumb?
Yes.
Has to touch my femoral condyle, so you have to flex the IP joint, right?
That's true.
Okay? That tells you right away you have a step off. Try the other side. If we just did that, we would determine what is normal, what isn't. And you could always check the other side, like you are here, to determine that step off. You wouldn't even have to do a posterior draw.
That's true.
Okay, so we've eliminated by just doing this.
Yeah, test. Okay. And then as far as the posterior drawer, did you keep your thumbs in that position? Or did you actually
Switch spots with it. Scoot up a little bit more. Will Quinn have this on YouTube tonight?
Yeah.
being famous?
Okay.
Trying to relax my hamstrings.
Okay. So actually, I keep my the pulp of my thumbs on there when I push.
Okay.
Okay. You could keep the IP joint and then push, keeping the thumb straight. So if this hit the femoral aspect, that means you're going posterior.
Okay. Are you still trying to observe a soft, mushy end?
Oh, absolutely.
Somewhat?
Yeah,
Okay.
yeah, absolutely. Good point. Excellent point. It's the same. Quinn, will this be on YouTube tonight?
I can put this right on your computer right now.
Where did you get this camera? Must be famous.
It's my wife.
Not much more.
See, now you get to check your technique.
Of course. That's true. Thank you.
Okay, now
What'd I
let's
do without
do the active
What?
quadriceps test. You lie down.
What do you think? Okay, so it's like...
This will be the active quadriceps test, designed by Dale Daniels and Mary Lou Stone, 1988, Journal of Bone and Joint Surgery. All right, so from this position, I'm going to relax the hamstrings. I'm going to stabilize your foot. I'm just going to say slide your foot straight. Okay, good, and relax. And again, and relax. So normally you could see this tibial condyle, what it's doing, and in a posterior cruciate deficient knee, in this position, the tibia will then be subluxed posteriorly. So if we contract the quadriceps, the tibia will move anteriorly. and that would be indicative of a posterior cruciate tear. Active quadriceps test. Okay?
Isn't it ACL?
No. PCL.
If you push the forward?
Nope. Look, Dale, look up the active quadriceps test. Check the mechanism. Okay? In a
Yeah, really
posterior cruciate deficient knee at 90 degrees, this tibia would be subluxed. If you contract the if you have the patient slide their leg, what's going to happen is it's going to move forward by about 2 millimeters, and that's considered a positive test.
For PC?
PCL. Okay? You have to look up the ASR first. Okay? In a normal knee at 90 degrees, when you do this test, the tibia should actually move either none or slight amount posteriorly. Active quadriceps test. Okay? You try it.
Based on your experience, is the 2 millimeter translation pretty noticeable?
Yep. If we can see it on those pictures, it's noticeable.
Okay. Same as I think. Try to relax your hands
Now,
as much as you can.
you before we do anything, you just watch my tibial condyle. So, but you have to hold it,
Okay.
and it should move none, or it might move posteriorly.
Okay, let's try that again.
Okay, it's a quick one.
Okay.
With your right hand, put your hand here, and let's see if you can feel it.
Okay. Do it again.
Not a
Probably
whole lot.
nothing. Yeah.
Okay. Now feel those condyles just to make sure I have that 10 millimeter step off. It's easier now with the.
Yes, much easier. So yes, you definitely have to
So
flex
if
your
you
IP
put the
joint.
IP joint on the tibial condyles, you have to flex the IP joint to touch the femoral condyles. That means you have a knee that's in a normal alignment and it's not posteriorly sagged. So your posterior cruciate is intact. If it wasn't, you'd be sagging posteriorly.
But isn't the ACL that holds the tibia from sliding forward?
Yes.
So
But
why?
it's not injured.
Okay.
Okay, so for that reason right there, your tibia, when you have a PCL, would be posteriorly subluxed, so that if you contract, it would pull the tibia anteriorly because it's posteriorly subluxed, but it will be restrained by the ACL. Gotcha?
I got it.
Okay, that's it. That's good.
That makes sense.
That really brings it all together.
Yeah, I just wanted to
Okay?
make it clear.
Okay, time out.